All right, good morning, everybody. Thank you for joining us for today's webinar. My name is Melissa Davis. My pronouns are she, her. I am one of the Office of Equity's event managers. Today on the call, we have, oh, sorry, bebopping from my thing. Today on the call, we have a cart captioner who is Bridget. To use this, click the live transcript CC icon at the bottom of the screen next to the reactions icon, and then click show subtitle. We are also joined by two ASL interpreters. We have Paula and Amanda on the call. Thank you all for joining us. If you want to ask questions or interact, you can use the chat feature today or raise your hand. And then please mute yourself as well. So with that, I'm going to turn it over to Marcos. Take it away.
Thank you, Melissa. Can you hear me clearly?
And yes.
Okay. Good morning, everybody. It is good to be joined with you today. My name is Marcos Marquez. I'm a senior consultant at Clear Impact. I use he, him pronouns. And we'll be covering an introduction to a method called results-based accountability and connecting it to the work of advancing equity in the state of Washington. And so I'm very grateful to be here with you all today. We have quite a long day planned here with lots of great content and lots of great engagement for you all. Before I do anything further, I do want to just mention here that we will have breaks and of course we'll have lunch. And so our first break will be a 10-minute break and we will schedule that at 10:30 Pacific. We will go to our lunch break, which is going to be a little bit longer than normal. I'm in Texas. I'm in San Antonio, Texas, and it is school pickup right in the middle of the break time. And so because of that, we'll have a break Pacific time, 12 o'clock noon to 1:30, and then we'll restart the training right at 1:30 Pacific. We'll have our second break at 3 o'clock. That will be a 10-minute break. And then we will hopefully be able to adjourn. We're scheduled to close. I think the time is 5 o'clock, but I'm hoping we can get out a little bit earlier, which would be great, give you back a little bit of time in your day. And so with that being said, I'm going to go ahead and move us forward. And I am going to put a slide on that will help to introduce me, but I also really want to get to know you, especially because we're going to be spending the day with each other. And so if you would please type into the chat your name, the agency or department or program you are with, and the role you play at the agency or department or program that you are with. And so please introduce yourself in the chat, your name, organization, and role. Okay, and so let me go ahead and put the slide up to help introduce me, and then I'm also going to be connecting to you all as I see you adding all of your introductions into the chat. So a little bit about me. I've been with Clear Impact for 10 years. Prior to joining the company, I worked for nonprofits of all shapes and sizes. Most recently, I worked for the United Way of San Antonio and Bexar County. San Antonio, Texas is my home. And so I worked at that United Way for many years. But since joining Clear Impact, I've had a variety of experiences helping groups, helping organizations, helping communities to learn and apply this method that you're going to learn about today. We call it results-based accountability, or RBA for short. There's a lot of projects that are on the screen. There's many, many others actually that I'm working with or that I have worked with. Really, at the end of the day, I think the most important thing for you to know is that I've spent a lot of time helping folks to use this RBA method. I do want to call out two projects that I think are salient to the training today. One is with the city of Cleveland. And so They announced racism as a public health crisis. This is Cleveland, Ohio, announced racism as a public health crisis almost 5 years ago. And, there was a huge proclamation by the mayor and city council. And then a year plus later, they came to Clear Impact and asked if we could help them really put some thinking behind this proclamation and some work behind this proclamation. So we said, absolutely, we sign us up. We're happy to do that. And so I was the consultant connected to that work. And in Cleveland, what we did, again, with racism as a public health crisis as the frame, we engaged community partners. These were organizations, residents, um, a really wide mix of people, but they were working in 5 concurrent priority areas. One was criminal justice, one was education, another health/public health. The fourth was housing, the environment, and infrastructure. And the fifth was workforce development, economic mobility, and wealth creation. And I'm sharing this story with you because think about how different each of those priority areas are. They used the RBA approach or the RBA methodology, even though the work was very different in each of the priority areas. There was consistency in the way they approached how they decided what strategies do we undertake to address systemic racism in our priority area. So I'm sharing that example so you can kind of get a sense of how RBA can be used on a very big scale. This was the entire city. It was actually the region. Cleveland is a region. And so lots of work, very, very much collective impact kind of work. Another project that I want to highlight very quickly for you, just in terms of experience, is I've worked with, let's see, so there's public health. I work with a lot of public health agencies, Los Angeles County Public Health, Santa Cruz County, Sacramento County, doing a lot of work in California right now. But in those projects, what I've done with those projects is engaged the departments and programs, the managers, the directors, the staff that are responsible for the programs and services inside of those health agencies, wide variety of programs and services. Sometimes it is focused on oral health for young people or adults. Sometimes it's focused on community health workers, making sure that they're able to provide education and outreach to people about important public health issues. Whatever the program or service is, they have used RBA, they've learned RBA and used RBA to be able to drive performance improvement in that work. So those are 2 examples I want to lift up just so you can see the most important thing here is that RBA is very practical and useful. So folks, we have a long day. And there are 5 things that you hopefully walk away with. And so I want to just touch base on each of these for you. So we want to make sure that you have a shared understanding about the RBA method. What is it and how does it work? We want to also introduce the 2 types of accountability. Now, I actually just alluded to them in the examples I shared with you. So the first type of accountability, we call it population accountability. And this is when we are organizing the work to advance community outcomes or community results. The second kind of accountability is performance accountability, and you'll learn about that as well. So how does performance accountability help to improve client outcomes for those programs and services that you are operating or administering or managing or supporting? The fourth bullet on these objectives is the part that I'm most excited about for you, because there is a process inside of RBA. We call it turning the curve. And this turning the curve process can be used to create improvement for people. either at scale or within the programs and services that we operate. You'll learn about that turn the curve process. And then the fifth thing that we want to do is just give you a sense of how can you apply RBA at a systems level to advance equity. And of course, we're here. I'm sure each of you plugged in this morning because you are trying to understand RBA, but also how does RBA to equity? And so that last bullet there, we want to make sure that that is made very clear for you all through the training today. Okay, so I do want to just pause for a moment, and it's great. I mean, the wide variety is fantastic. I'm just going to call out a few folks that, or not even folks, but just different roles that I'm seeing here. So we have an employee experience manager from the Department of Enterprise Services. We have a section manager for Department of Health. We have someone with the Department of Ecology. Wow. And they're with the HR department within the Department of Ecology. We have an IT supervisor with Washington's Lottery. We have a an equity and inclusion program manager with the City of Lacey. Folks, first of all, thank you for adding who you are in the chat. I will definitely be connecting to that as we move through the day today. What I want to lift up and just those quick people that I highlighted for us is that there's an incredible variety of role represented in this room today, quote unquote room. There's also an incredible variety of departments. And what I appreciate about the RBA methodology that you'll be able to learn about today is that it is absolutely tailored for each of you. No matter what kind of work you are engaged in, no matter what level you are engaged at, whether you are executive, senior leadership, middle management, staff person, my gosh, even residents who are engaging the services that we provide, or other clients that are that we provide the services to. Doesn't always have to be residents. Of course, we might have clients that are other agencies or inside of our organization if we provide indirect service. But the RBA methodology is flexible enough to be able to speak directly to each of you and help you to think about, how do I advance equity within the work that I am charged to do? And again, there's a wide variety of role and organization in the room today. So we're going to start off with a quick icebreaker exercise. And here's what we're going to do. We're going to do something called design to fail. We're actually going to think a little bit about failure this morning to get us started. And it will help to frame the RBA method that we're going to learn about for the rest of the day. So the icebreaker exercise, what I want us to do is there are 100, there's over 100 people in the room. And for the next couple minutes, we are all part of a team. All 107 of us are on the same team. It's a very large team that we are part of. But in this icebreaker exercise, what we are going to do right now is to do some diagnosis. All 107 of us have been part of a project together. We've been working very hard on this project. It's taken us a year to get over the finish line. And we got to the end, and we do recognize one thing that's important for us to recognize is that there was zero accountability in the project that we were part of, zero accountability. And unfortunately, we are at the end of the project, and it turns out that the project was a failure. It did not produce the results that we were hoping for. It actually, it just was not great at all. And so what we want to do here is just take a moment to try to understand what went wrong, what caused this failure, what were the factors contributing for this failure to happen, or also what wasn't happening. What wasn't happening in our project team or our project implementation that contributed to the failure that we all experienced. And so I want everybody to take a couple of minutes to write your ideas down. And then I'm going to, we're going to move over to a Mentimeter. And what I'll do is I'm going to put a hyperlink into the chat. When you click on the hyperlink, please click on the hyperlink and you can add your contributions, your thoughts about what led to this failure. You can add them into the Mentimeter, and then we're going to look at the content together very quickly. So it'll be a way for us to facilitate in a fast way to be able to understand what everybody is making sense of. All right, so again, the question is, I'm going to add the question. There's two questions. I'm adding them into the chat. Take 2 minutes to write. I'm going to use the timer here. And in about a minute, I'm going to add the Mentimeter into the chat. And you'll be able to add your thoughts in there. And then we'll take a look at what everybody comes up with together. So I'm starting the timer now. We have 2 minutes of this reflection time. At the minute mark, I'll put the Mentimeter link into the chat and we'll be able to, what is the definition of failure? Karen, that's a great question. I would say that it was a disaster. It wasn't just a failure. We had the project itself, if it was a souffle coming out of the oven, it was totally flat when it came out. Complete bomb of a project. Karen, I'll leave that to you to, let's see. So the project didn't happen. The project did happen, and it turned out to be the exact opposite of what we were hoping for. Thank you, Kathy. I'm about to put into the chat the hyperlink, and there it is. If you would please just click on the Mentimeter that's now been posted to the chat. And we're going to look at that Mentimeter in just a moment as people add their responses to it. Okay, team, I'm going to go ahead and share a different screen, and you're going to see now all of the contributions that everybody has started adding. Thank you for all of your ideas that are starting to percolate. Let's take a look at what you came up with. Lack of role clarity, lack of buy-in, unclear deadlines, lack of accountability, lack of clear outputs and expected outcomes. The communication was lacking, unclear roles and responsibilities, lack of a transparent decision-making process. The work was happening in silos, poor planning. Activities weren't aligned with the causal factors of the thing you were working on changing. Lack of performance indicators. So we weren't measuring, we didn't have a way to measure or benchmark or understand progress over time. Lack of milestones connected to that performance indicators. Lack of communication and teamwork. Lack of a charter with a clear scope and goals and metrics. None of the impacted parties were part of the planning and implementation. The team was too big. Whoever wrote that, yes, absolutely. We have a 107, 108 person team. Perhaps it was too big. Lack of ownership of the work. Lack of definitions of success. These are all very solid things that contributed to the failure. Thank you for adding these into the Menti. Inability to come to a consensus and have transparent and clear communication. No checks, no milestones, no deadlines, lack of management support, possibly a lack of bandwidth. absolutely, maybe even competing priorities contributing to that lack of bandwidth. We're all wearing 5, 6 hats, and everything's important, and therefore nothing is important because it's hard to prioritize in that environment. All of these make sense. Okay, so we're not going to spend a whole lot more time on this. I wanted to just elicit some thinking from you about what caused this project to turn out the way that it did. Thank you for all of your contributions. And what I do want to say to you is that this RBA method that we're about to dive into, in many, many ways, counteracts all of the things that we've just surfaced through this very quick icebreaker exercise. And so I'll definitely want to come back and check in with you all towards the end of the day around how these things that we just discerned can contribute to failure in a project, how they are addressed when we are applying results-based accountability well. So I'm going to bring us back to our main screen, and I'm going to keep moving forward. I do want to double check with everybody. Are you now seeing the main screen? Melissa, are we seeing the main screen here?
Yep, you're good.
Great, thank you. Okay, all right, so what is RBA? So I keep talking it up. What is this thing actually all about? What is results-based accountability? So I like to think that RBA is 3 things all at the same time. It's all 3 of these things. The first thing that RBA is a framework or a structure. And as I mentioned to you already with that example from Cleveland, Ohio, 5 priority areas, all very, very different: criminal justice, education, which was early childhood, K through 12, higher education, college and career, you name it. All those partners in the education world were all working together. Another group that was focused on health and public health.
Good
Oh, I love the laughter, but could you mute yourself, please? That would be great. Thank you. So all of those different partners that were involved in each of those priority areas, the RBA method, that structure or the framework, worked because it's flexible enough to put on each of those very different types of efforts, those initiatives. The structure of RBA can also be narrowed down to help an organization think about improving outcomes within the single organization itself. How do I make sure that the programs and services that I'm implementing are creating the outcomes that we're hoping to see for the clients that we serve? RBA's structure allows for all of that work that I just spoke to. The second thing that RBA is at the exact same time is a process. And you know, I love chocolate chip cookies. They're like one of my joys in life. And so if I'm going to make chocolate chip cookies with my kids, then we're going to Google best chocolate chip recipe in the universe, and we're going to follow that recipe to the letter in order to make sure that we pull out some cookies from the oven that are super delicious. We're not talking about cookies when we are thinking about using RBA. We are talking about improving the lives of the people that we serve or improving conditions in our community. There is still a process that we want to use. And this process that's kind of in the middle of RBA or the heart of RBA, we want to use this process consistently. I'll explain that to you a little bit later. Hopefully we'll have some time to see some examples of what it looks like when communities and organizations use this process. The third thing that RBA is a culture. So the culture that we want to create with RBA is a culture where there is shared accountability for the results. Shared accountability for the results. And that is true whether it is collective impact, where lots of organizations are working shoulder to shoulder to advance outcomes at scale. It's also true when we have staff that are working within our agency or our service system or our program or our service that are doing the work, the actual work on the ground. How do we make sure that there is shared accountability for the results? Well, we use the structure of RBA and we use the process that's inside of RBA called turn the curve. And as we do that, as we apply these RBA principles, the more that we apply these RBA principles, the stronger the culture of shared accountability for the results, the stronger that culture becomes. And I've seen this. I've seen it happen inside of organizations. I've seen it happen across organizations. And so I truly do believe in these three things, that RBA is all three of these things. You'll also notice at the bottom of the screen that we absolutely want to use data. We want to apply data-driven decision-making. So data is hugely important, and it is sort of job one almost in RBA is let's make sure that we are looking at our data in order to drive the strategic planning, in order to drive the action planning that we want to implement in order to improve outcomes for people. So I'm going to keep moving this forward. Another hallmark of RBA, and this should be no surprise, it's the first word in the name, results-based accountability, but we want to always begin with the results in mind. We call this end to means thinking. So imagine that, in fact, I'm going to be in Washington State. I live in San Antonio, Texas, as I mentioned already, but I'll be in Washington State next week presenting on this RBA methodology to the Washington State Association of Local Public Health Officials. They are meeting in Walla Walla, Washington, and I'll be there next week to engage them in this information. And so imagine that I land at Seattle Tacoma and I just start driving, hoping, actually this is not the right direction, but imagine that I just started driving to get to Walla Walla without referencing any kind of map. And I just start, taking a highway and hope for the best. Who knows where I would end up? That's just not the way that we do things. I'm going to get in my rental, pull up Google Maps, plot the name of the place where I'm going to in Walla Walla, and it's going to chart the best route for me to take. Hopefully, avoiding traffic congestion and all the fastest route, the safest route, all those things. The point here is that this idea of end to means thinking is that this is the same approach that we want to take when we are doing our work to advance public outcomes, public sector outcomes, public health outcomes, public education outcomes, whatever it is, environmental stewardship. What is the end that we want to see, and what are the means that we need to undertake in order to accomplish that end? That is the idea that is driving this results-based accountability methodology. Another hallmark of RBA is the clarity of language that we use. In fact, we call this language discipline. I have trained farm workers on the US-Mexico border in RBA, and I'm fourth generation Mexican-American. Spanish is not my native language, and these were farm workers with a very limited formal education, extremely smart and wise and passionate about improving things in their community. But I trained on RBA, and this clear language was very helpful for. It's intended to be used. It's intended to help people be clear with one another. So let me move us forward, and I want to invite you to think about all the people. In fact, you might just take a moment and review very quickly all the people that are in the chat who just introduced themselves by name, but I want you to notice the agencies that are represented in the room. So as you're looking through the chat, look at all the different agencies and imagine all those agencies are in the room with one another in an actual work meeting. Let's imagine we convene everybody in a meeting, and we also have someone from the the police department, and we have someone from a hospital, and we have someone from business. And all these words are being thrown around in a meeting without us ever having taken the time to clarify what these words actually mean to each person. And we end up with a very hazy conversation, extremely hazy. So I'm going to read these words out loud just so you can hear them as well as see them. And also, I should have mentioned this to begin with, and I apologize. Let me just pause here for a second. I want to just give a shout out to our translators who are going to be doing some incredible work for us today. If anybody needs some additional language support, especially when we go to breakout rooms, if you would let our translators know, that would be super helpful. I think you can just directly message them, but I do want to lift up our translators today. So bringing us back, so I'm going to read these words out loud so we can hear them and see them. I'm going to start with the outside ring. I invite you to remember that we're in a meeting and there's all these different partners that are in the room, and we haven't taken time to explain what these words actually are referencing here. Target, benchmark, outcome, result, indicator, goal, measure, objective. And I'm going to add the modifiers or the qualifiers that are inside that ring there. Measurable, targeted, urgent, incremental, core, performance, priority, strategic, qualitative, systemic. There could be many, many more, I'm sure. And imagine that we're in this meeting now and somebody starts to use these words in combination with each other. Oh, well, we need to pull that report with the core priority indicators. Oh man, that sounds really, really, really important. But what are we actually saying here? So Mark Friedman, who developed the RBA method, always has said that if you are in a meeting and you hear someone use 3 of these words in a sentence, 2 or 3 of these words strung together in a sentence, that they don't know what they're talking about. Actually, that's not what he said. He said they don't know what the hell they're talking about, because it sounds important, but as soon as you start poking at it, what are you actually talking about here? What are the concepts that we're trying to speak to? It becomes clear that we're not using clarity in our language. So we want to get away from this. And what I'm going to do now is introduce to you 4 definitions that we want to use when we are using RBA projects. And team, I do want to make clear here before we go to the next slide, I'm going to introduce 4 definitions. I invite you to think about these definitions as you are using RBA. If you are using the words that you're seeing here on screen because a funder's asking you to, or a project that you've been part of has been using them, please keep doing that. Don't go back to the feds or the state and say, I'm sorry, I can't do that anymore. The trainer said we got to use these other definitions. Please don't do that. But what I do want you to consider is if you are beginning to use the RBA method in your agency and your work in the project or program that you are connected to, if you are using RBA, these 4 definitions that I'm going to introduce can be extremely, or not can, they are extremely useful to use. So I'm going to put them all up on screen here, and you'll notice that they're kind of split in 2. So on one side, there's 2 definitions that are connected to population accountability, and I'm going to explain that in just a few minutes. There's 2 definitions that are connected to performance accountability. Again, we'll explain that a little bit later. But what's important is to know that these 2 definitions, 2 go to population and 2 go to performance, so that we are clear about which scale of work that we are talking about. So I'm going to start on the top left, the word result. Let's make sure we know what we mean when we say that word. The definition, as defined in RBA, a result is a condition of well-being. It's an outcome for people. And in fact, it's an outcome for all people. So there are three examples that are down at the bottom, right below the definition, that from my perspective are fairly good result statements. They can be tightened up a little bit, and I'll explain that as we get farther in, but these are pretty good result statements. Children are born healthy, first result. Second result statement, children are ready for school. The third result statement, everyone in the community is safe. And so, team, what I want you all to do is tell me, or let's tell each other rather, in the chat, what do these result statements have in common with each other? Yeah, I'm gonna. So I appreciate what Daniel lifted up. They are aspirational, and I think Engel is also connecting to this. So they're positive. They are positively stated because they express what we want. This is the result. This is the end destination that we want to get to. Children are born healthy. Children are ready for school. Everyone is safe. We are asset focused, not deficit focused when we are writing our result statements. We are clarifying what it is that we want. Jim notes that people are first. So yeah, there is a focused population. Now, one way we can tighten these results is we might add where these people live so that we're clear about, are we doing this for all people in Walla Walla, or are we talking about all people in Bellingham? Very different populations, right? And so we got to be clear about that. Human-centered. I like that, Dana. Thank you and you got a thumbs up on that one too. Kale. Kale, I hope I'm pronouncing your name correctly. They are for a broad population group, absolutely. Sarah, you got an exclamation, and I'm gonna +1 that because I agree with you. They are difficult to measure as written. Another way we can say this is that they are broad, another way we can say this is that they're vague. Children are born healthy. I'm actually kind of clear-ish about what we mean by that. But that second one, children are ready for school, is very vague. What do we mean by ready for school? Do we mean that Dahlia has their homework is stuffed in their backpack before they walk out the door? And yes, dad has to check sometimes to make sure that that's actually true. What are we talking about when we say ready for school? So we are not clear. That the result statement itself is vague, and we're going to come back to that in just a few minutes. Jisoo, thank you. Clear and in plain language. We don't need a PhD to understand what we're talking about here. This is so clear that anyone in our community could understand what we are focused on. Anyone. They use words that have ambiguity built in from Chris. Yes, define, healthy, ready, safe. Yes, absolutely. So Chris, thank you for noting that. Here's the thing. We want to lead with aspirational, positive end conditions that explain who we are focused on. And yeah, they're going to be vague. They're vague by design. The reason they're vague is that the specificity that we need to understand what do we mean by this and how do we know how things are going, the specificity comes in the second definition that's right over on the left. It's the word indicator. And so I am going to explain what we mean by indicator. There's actually two types of data on the screen right now. And we're looking at, there's somebody who's coming in a little bit. And so let's see, if you could mute yourselves, that would be great. I'm not sure who that is, but if you would just double check your mute button and make sure it's selected, that would be awesome. Kale, I did pronounce your name correctly. Awesome. Just like the leafy green, kale is delicious. I will definitely remember you, my friend. So that's an awesome name you have. All right, so getting back to the definition. So our first type of data is called an indicator, and an indicator is a measure that helps us to understand progress for our result. So let's look at our three indicators that are there on screen. The first one is the percentage of babies born with a low birth weight. The second indicator is the percent of students ready to learn at kindergarten entry. They show up to school day one kindergarten and they're ready to learn. The third indicator is the crime rate. Now, let's look at the relation between these indicators. Am I not sharing my screen? Armenia, you're not seeing the screen?
I can't see it unless everybody else can, and I can't.
You can see it,
Oh,
Marcos.
We can see
oh,
it.
then I must have something wrong with how I'm viewing it. Okay, sorry.
No, no, no. You know what? Helen says you may need to change your setting. Can we give Armenia a little bit of help here so that
So
she's
if
able
you
to,
go
they're
to
able
your
to follow
view,
along?
if you go to your view button, you should be able to change your view. Or at the top in the middle of the screen, there's a button. It says Marcos Marquez's screen, and I think if you toggle that, it should work. We had this in the last one as well.
That's what it was. Marco's screen. Thank you.
Thank you. Thank you, Armenia. Thank you, Melissa. Thank you, everybody, for helping. All right, so team, getting back to the slides then. So let me just make sure. Okay. All right, so let's make some connections. Our first result, children are born healthy. The indicator connected to that is the first indicator, the rate of low birth weight babies. So let me ask you, if the rate of low birth weight babies, let's just say it is for Walla Walla, for demonstration purposes. If the rate of low birth weight babies in Walla Walla is increasing every year, how are we doing with the result? Children in Walla Walla are born healthy. The rate of low birth weight babies in Walla Walla is increasing. How are we doing with our result? Bailey, Daniel, Amanda, not great, not doing well, doing poorly. I would agree with those quick. Yes, we want the rate of low birth weight rates to decrease, not increase. If it's going up, it's not going in the right direction. Okay, so team, great job on responding to that. What I want you to notice here, there's a couple of things that we just did. We are leading with our result. What is it that we want to see in our community? All children in Walla Walla are born healthy. We use an indicator to understand progress for that, to help us understand what we mean. How do we define this result? But also, how are we doing on the result? So the way we are understanding the result is we are looking at the rate of low birth weight babies. And the data is going in the wrong direction, tells us that we are not doing great. Not great. And now we got to figure out, what do we do to turn that curve? What do we need to do to change things and move things in a positive direction? Okay, so again, let me just back up a little bit. We have a result, which is a condition of well-being. It expresses what we want for people. Broad, aspirational, vague, as a focused population. And then we use it, this indicator as a type of data that we're going to use to understand progress for a result. Indicator data is population level data, community level data, region, county, city level data. We're going to go to the other side of the screen now. Our third definition is a program. And you know what programs are far better than me. And so this is just how services make their way to people. What's important here is that we have a second kind of data on the screen, and we're going to call this a performance measure. It sounds different. It is different. A performance measure is a type of data that we use. It's a measure that we use to understand how are we doing with our programs and services. Actually, how are we doing with our strategies and programs and services? And so there's three kinds of performance measures that we can use to understand how we're doing. The first kind of performance measure is when we're thinking about how much did we do. The second kind of performance measure, we're thinking about, hey, did we do a good job? How well did we do it? The third kind of performance measure is when we ask, what difference did it make? Is anyone better off because of the things that we do? And so now what we've done, just by virtue of introducing these four words, or these four definitions rather, is that we have a way, structurally, we have a way for us to understand, to make sense of the RBA structure. I am a very big believer in the RBA structure. So the structure here is we use results and indicators when we are doing the work to advance population accountability, all people in a broad geography. We use programs, or we implement programs and strategies and programs and services, and we use performance measures to understand how much did we do, how well did we do it, and is anyone better off as we are advancing performance accountability. This is where we're thinking about improving the performance of the work we do in order to improve client outcomes. So there's your four definitions. And now, team, you are ready. You are ready for a pop quiz on a Thursday. Congratulations. So I've got a Family Feud slide ready to go. And the question here is, what are these? There are 8 things, 8 concepts on the screen. Is it a result? Is it an indicator, a program, or a performance measure? So I'm just going to read each one, and then I'm looking for you to respond in the chat what you think it is. So the community is safe. What is that? Man, look at that. Woo, that was good. All right, survey says that you are rocking. Number 2, the crime rate. What is that? I'm loving this, y'all. You got it. You got it. Absolutely. Okay, so a quick note here, because I look at data all day long. If I'm looking at a measure and there is no program name or service name connected to the measure, I'm going to immediately make an assumption, which is that this is an indicator because it is at a whole population level. So that's the way that I'm making very quick sense of, is this an indicator or performance? You did a great job on that. It is an indicator, the crime rate. What about number 3, the average department response time? What is that? Yeah, you guys got it. All right, it is a performance measure. You are cooking with Wesson oil. Love it. Number 4, actually, let's say olive oil, because, you know, Wesson oil, no. Olive oil, you're cooking with olive oil. Number 4, residents have living wage jobs and income. It is a result. Now, there is no measurable aspect here. If we had percentage of residents with living wage jobs and income, that would be an indicator, but there's no measurement connected to this. It is a result. It's a condition of well-being that we want to arrive to. Number 5, the adult literacy rates. Man, gold stars for everybody. You all came to play today. Number 6, the Department of Public Social Services START program. Yep, it is a program. Good. Number 7, the percentage of people with living wage jobs and income. It is an indicator. Remember my little tip that there's no program in here. So I'm going to, as soon as I see that there's no program in there, I'm going to know that we're talking about an indicator because it transcends, it's beyond any single program. It's something that is at the level of a community. Number eight. Number eight, is that a result, indicator, program, or performance? Yeah, team, you all got it. You all got it. Okay, that was great. Good job, everybody. Good job. Well done. So I'm going to move us forward, and we're now going to talk about this first kind of accountability in RBA that we call population accountability. And we have a helpful graphic here. So for me, when I'm thinking about population accountability, I think of it as the big circle. Performance accountability is the smaller circle. So population accountability, big circle, we're thinking about the well-being of all people in a broad geography. That could be at the level of a census tract. It could be within a zip code. It could be for a town or a city or a county or a region. It could even be a state. I'm currently working with the state of Arkansas, and they are thinking about uh, public health outcomes at the level of the entire state. It's just a really, really huge project that we are working through. So some examples of result statements, and we've already seen these already. All residents have good jobs. All children are ready for school. The neighborhood is safe. So what I want you to know is that we want to lead with our results. Why do we want to lead with our results? Well, if we lead with clear results, number one, it helps us to all have oh, that's the North Star that we're all working towards. Got it. Makes sense. But also, when we use good result statements or well-crafted result statements, it invites people from across the spectrum in our community to say, you know what, I want to be part of that work. We might have differences in terms of the approach we need to take in order to arrive there, but we all can agree that we want children in our community to be born healthy. We can all agree that we want people to have good livable wage jobs in our community. So the results create a big tent, a big enough tent that all people can be working towards it. Okay, so let's think about this result statement. It's very important for us to have a clear result statement to get started. There are four elements that we would want to see in our result statement. Number one, we have to be clear about where this is happening. Or I'm sorry, sorry, that's not right. I didn't read that correctly. Apologies. So the first thing is we need to be clear about who we are focused on. Who is the population? We want to make sure we are connected to the geography where we are focusing this work. We want a present tense verb because this is a state of being that we want to arrive at. And then what is that well-being condition that we are seeking to advance? So let's fill these blanks in, just like a Mad Lib. If you remember Mad Libs way back in the day, we're gonna make a Mad Lib here with our result statement. So our population, we have all women in Washington State are healthy. It's very, very easy for us to understand what it is that we are focused on. I do want to make a note here that these are not goals. A goal, as you all very well know, I'm sure many of you write goals for projects that you are connected to, would be something like by 2030, all women will see a reduction in or an increase by 30% of yada, yada, yada. That's not what this is. This is a broad statement that is aspirational. And the reason that it is designed this way, again, is because we use those indicators connected to our results to understand how are we doing and what do we mean by our result, but also how are we doing with the outcomes connected to those indicators. Okay, so a little bit more on results, and then we're going to move into thinking about the indicators themselves. So I do want to just put up here on screen. This is from a community, Christchurch, New Zealand. And these result statements, the city actually crafted these result statements, and then they ended up in like the city charter or something like that. So that the city said, okay, these are the things that we want to accomplish. These are the end conditions that we want to see. And then the government said, okay, how do we go about measuring progress for each one of these results? What are the indicators we use to understand that the city is well governed, that the city and its people value and protect nature? What are the indicators we would use around inclusiveness and diversity in terms of safe conditions in our community? What about the indicators that would help us to understand progress for the city and our people are prosperous? What indicators would we use for that? What about healthy people in the city are healthy? Oops, sorry, I went a little too fast. Anyway, the idea here is that you lead with your results, and now you go about the business of what are the indicators that we use to measure progress for them. So in order to understand progress or the result, we are going to need an indicator, or actually we might need more than one indicator. We need multiple indicators. In RBA, we teach that you need somewhere between 3 to 5 indicators for a result. If you have less than 3 indicators, you don't have enough information to help you understand how you are doing with your results. If you have more than 5, you'll have too much going on in terms of the actual work connected to a result, and it just becomes very messy and burdensome and overwhelming, I think is a good word for that. So what I'm going to do here is I'm going to add several indicators, actually 4 indicators to this screen. Team, what I want you to know, this is to illustrate what I just spoke to. We want somewhere between 3 to 5 indicators to help us understand progress for a result. Here are 4. They're just intended to illustrate the point. But what you can see here is that by these illustrations, each of these indicators by itself says something about the result. But when you see them combined, it tells a fuller story. It helps us to have a more comprehensive understanding. Number one, a more comprehensive understanding about what do we mean when we say result, or what do we mean when we say people in the city are healthy? What are we talking about here? But also we can look at the data connected to these indicators. And my eye was pulled over because I saw the picture show up in the chat. And I love Smarties. I don't know about y'all, but those are good. I definitely have a sweet tooth. I gotta admit that. Anyway, coming back to the slides. So we have low birth weight, the diabetes rate, access to medical home, which is, does a person have a primary care physician? And then the air quality index in the community. So each of these, now they're all different, right? And they're all connected to potentially different populations. There might even be overlap too, of course. But if we're looking at the data connected to these indicators, we start to have an understanding about how healthy are people in our city. So if we're looking at low birth weight, of course, we can begin to have some understanding about the birthing parent. Were they, what kind of prenatal routine were they on? Did they have vitamins? Did they have regular checkups? Were they able to eat well? What kind of healthcare were they provided? What kind of support might they be receiving from family and peers during their delivery? During their pregnancy, excuse me. Are they walking? Are they drinking lots of water? All those things that can contribute to this unfortunate indicator around low birth weight babies. The diabetes rate, we might begin to understand, the availability of nutritious foods in a particular community. the walkability of a neighborhood, the safety in the neighborhood. Do I feel safe being out and and exercising later in the evening? Uh, what about predisposition, exercise, all those things, and then access to. Anyway, I could go on and on, but the point I'm trying to make here is that each indicator helps us to begin to understand how are we doing in relation to the result. And when we use them in combination, it helps to paint that fuller picture that we are wanting to understand. More importantly, all of this is helping us to get to a place where we can look at the data connected to these indicators and actually work on it, actually work on the data. So we would be doing a turn the curve planning process on the indicator data to figure out what are the right strategies for us to take action on at the level of the community, where we're involving multiple community partners to be part of the work to improve the data that we're seeing for our indicators. So a little bit more about indicators here, a few more slides. And we are right at 10 o'clock. So just want to make a confirmation. Actually, I think when we get to the end of population accountability, we'll go to a quick break. So it might be a little bit sooner than 10:30 Pacific, but just want to make sure that we're connecting to the breaks. So indicators, where does that data come from? Where does the indicator data come from? Indicator data is going to come from big data, maybe the US Census or the Washington Department of Education or the Department of Health, or we go to the Annie E. Casey Kids Count database, which has tons of data. That's what they do, is they sort of amalgamate all of the data and then put it out there for people to use. Maybe we go to the Robert Wood Johnson County Health Rankings. There's all kinds of places that we can go for that big data, but it's going to come from extant sources. What's important to know is that indicator data does not come from client data. Indicator data does not come from program data, or even from an organization or an agency. It would, if at that level, if we're talking about data that's connected to programs and services, that is different, and that is performance measure data. So I will make some connections for us between results and indicators and programs and performance measures. I'm gonna bring all of that into alignment a little bit later today. But for now, just know that we do keep these separate. Results and indicators are separate from the other side of RBA, which we'll talk about a little bit later. Imagine, and now there's more of y'all. We are now up to 112 people in the Zoom today. So thank you for being here. And imagine that we're in an actual meeting, and the meeting is to think about improving we want to see residents in our community have a livable wage. That's what we're here for. And we come back, we recreate this meeting with 112 people in 2 weeks. And the homework between today and 2 weeks from now is, folks, go out and find your favorite indicators and let's bring them back so that we can decide which indicators we're going to use to understand progress for this result that we care about. And Juan brings 3 indicators, and Roxanne brings 5 indicators, and Edminia brings 7 indicators, and Ingle brings 23 indicators. Ingle loves indicators. They're really, really into indicators. So we end up with a ton of indicators in 2 weeks when we come back together. How do we choose? How are we going to choose what indicators we want to adopt? We're going to use a set criteria. And here are the 3 criteria that we use. And the first criteria, remember what we're doing here is we got like 70 indicators, and we got to bring it down. The trainer said we need somewhere between 3 to 5. So we got to winnow it down quite a bit. these three criteria help us to make choices about which indicators to adopt. The first criteria is communication power. So let's see. Let's imagine Melissa Davis, who's with the Department of Equity. Melissa, are you there?
I am.
Okay, Melissa, what is your best friend's name? Who is your best friend?
Jesse.
Jesse is Melissa Davis's best friend. And so, what's the grocery store chain in Washington State where you're at?
Safeway?
Okay, so team Melissa is at Safeway on this Saturday afternoon, 2 days from now, and it's 11 in the morning Pacific, and they're pushing their cart, and they get to the end of aisle 12, and right when they get to the end, they bump carts with Jesse. Jesse's there doing some grocery shopping at the same Safeway, same time, same place. And Jesse says, "Oh my gosh, Melissa, I haven't seen you in a hot minute. It's so good to see you. How are you doing? I've been following your Instagram. You're living such a great life. By the way, I hear you're doing that work with that community impact initiative. How are you measuring progress?" Jesse's kind of wonky that way, and Jesse says, "How are you measuring progress?" And if Melissa tells Jesse, "Oh, we're using this indicator to quantify progress for our result," is Jesse going to automatically understand what the indicator means? Or is he going to look at Melissa and say, "Melissa, are you okay? Because whatever you just said, I have no idea what that meant." We want to use indicators that can speak to a broad audience immediately. And so we're looking for indicators with strong, clear communication power. Resonance, Chris. Yeah, it could be resonance. I think that might be sure. What do you mean by resonance? I see you're putting that into the chat.
Yeah, it's really just does the concern, like, to your point, right? Like, if I'm making a statement or having a conversation with somebody on the street, are they going to understand what it is I'm speaking of, right? Like,
Yes,
does it resonate with them?
Mm-hmm. Yeah, that's exactly it. That is exactly it. So that would actually be one aspect of the criteria. We're talking about communication power. Resonance would be something we would want to think of. And to Lenny's point, who is amplifying Karen's point for this decision, does the impacted community have a role in deciding what the indicators are? Absolutely. Absolutely. So I'll speak to that in just a few minutes. Let me go to the second type of criteria. This is importance power. So, and I did see the question from Daniel about the data herd. So I'm going to explain that in a second. When we're thinking about an indicator in relation to importance power, we want to ask ourselves, how relevant is the indicator to the result? If the needle is moving on that indicator, how much impact is that having on the result? Is it a lot? Is it a little? So another thing to consider here in terms of importance power is the data herd. I'm going to give you two indicators, and I'm going to type them into the chat here. So indicator one is the percent of birthing people who receive prenatal care in the first trimester. Apologies for the typo here, but the second indicator is the rate of low birth weight babies. Okay, so you can see both of those in the chat right there. My question to you is, if the percent of birthing people who receive prenatal care in the first trimester is increasing, what is happening to the second indicator? And you can put your response into the chat. That would be great. Yeah, I agree with you, Susan. Absolutely. It probably is decreasing. It should decline. Yep. So this is what we mean by data herd. So if we had to pick between those two indicators, we would pick prenatal care, because if it's moving in the right direction, the odds are really good, odds are really strong that the other indicator is going to be moving in the right direction too. So that's how we're making a decision around data herd when it comes to importance power. The third criteria, data power. Do we have the data? Like, hey, we got some great indicators here, but this one we actually don't have a data. There's no data for it. Oh well, we shouldn't be including that in our list here. Is it timely? Is it available in a timely manner? Is it cost effective for us to reproduce the data? Is it quality data? Is it reliable data? All of those sort of nuts and bolts questions, that's what we were thinking about when we were trying to understand data power. And so what we're doing here is we want to use something that's very similar to this. So remember, we come back in 2 weeks. We've got 70 plus indicators because y'all brought a whole bunch of your favorite indicators back in, and we got to make some choices. And so what I would want us to do is to write those indicators out. Everybody brought your favorite indicators. We're going to list them all out on a sheet very similar to this. And then we're going to score them across the criteria categories. And what we're looking for is high. We're going to ask ourselves, is this high, is it medium, or is it low in terms of communication, importance, or data power? And what we're looking to rally around are the indicators that score high across all three criteria. If it scores low in one of the categories, we would put that on a data development agenda, or it's just a fancy way of saying a parking lot. And so we don't want to throw it out. What we'd like to do is just hang on to it, and then let's see if we can't resolve the issue that's keeping it from scoring higher. And if we are able to resolve it, and now it's high across all the categories, we can fold it into the mix. All right. So what that ends up doing then for us is we have 3 types of indicators. We have headline indicators that we're going to actually use, and we're going to use them in our turn the curve planning. So that example I keep referencing in Cleveland, they went through an indicator selection process like I just described. Each of the 5 areas, criminal justice, education, health and public health, housing, environment and infrastructure, wealth, workforce development, economic mobility, and wealth creation. All 5 of those groups went through their own indicator selection process. They had headline indicators. Each of those 5 groups had headline indicators. And they said, okay, we're going to do turn the curve thinking on our headline indicators to develop strategies that our collective impact will be organized towards. The second type of indicator on our list is secondary indicators. So they're just going to show up in our reports. We're not doing the deep thinking that turn the curve planning would want us to do, but we're still going to report on them so that we have a better understanding about how things are going over time. And then remember that data development set, they didn't score high enough for whatever reason. Let's not get rid of them. We're just going to put them to the side until we can address what's keeping them from being stronger, and we can fold them back into the mix. Okay, so team, we're about to go to break. Before we do, I just want to reinforce here. So if I were on your team and I just went through this population accountability introduction, and the 2 of us or 4 of us or 6 of us, however many are on the team, if we're all sitting there and we're asking ourselves, okay, what are we actually going to, like, I get all these ideas, but what does it actually mean? What do we want to do if we want to do population accountability? This is how I would want us to approach it. So we are applying population accountability. Let me say this even more clearly. We are wanting to execute collective impact across institutions, across agencies, across partners in a community. And this is what we would want to do. We'd want to, in one of the other trainings, the word stakeholder got called out for being having some very negative connotations, and so I would just invite us to please replace that word, and I can make that tweak on the slide. But I would just say conducted by community partners at a systems level is a much more positive way to think about it. But still, the idea is we are engaging our community partners at a systems level, interested parties. Thank you, Omar. I would say, let's first make sure we are clear about the result. What is it that we want to, what is the condition of well-being that we want to improve for all people in our community? The second thing we would want to do is to say, okay, we know what our result is. We want good paying jobs, or we want people to be healthy, or whatever that outcome is. What are the indicators we're going to use to measure progress for the result? We've done that work. We winnowed it down from our 70 potential indicators to the favorites that we have, our 3 to 5 indicators that we're going to use. And then for those indicators, we would apply turn the curve thinking, which you're going to learn about later, on the indicator data to identify what are the strategies we want to undertake as a community of partners. And then number 4, prioritize the strategies derived from turn the curve thinking, and we would implement those collectively. Implement the strategies and evaluate the impact they are creating towards that indicator data. Okay, so, all right, so team, and Yen, I appreciate you putting that into the chat. So team, I'm going to go ahead and send everyone to break. And why don't we make it let's just come back at the half-hour mark. So that would be 10:30 your time. We'll give a couple extra minutes. I know it's a long time to be sitting there watching some words on a screen. So we'll come back at 10:30, but we'll restart right at that half-hour mark. Okay, welcome back, everybody. So we're going to go ahead and dive back in. And I did respond to the question added to the chat. When is the lunch break? So we will go to lunch today from 12 o'clock to 1:30 p.m. Pacific, and we'll restart right at that 1:30 mark. We're going to go ahead and move forward with our content. And so let me make sure that our slides are still being shared. So remember, we spent a lot of time this morning already thinking about that big circle when we're talking about population accountability, when we're talking about how do we improve outcomes for all people in a broad geography. We lead with our results. As you can see on this slide here, we want to identify the indicators we use to measure progress for our results. We want to engage in a process, a thinking process, where we're looking at that data, the indicator data, and asking what are the strategies to take action on based on the strategic thinking we've done with our data reflection. We want to prioritize those strategies, and then we want to get to work as a group of partners. Working together on those strategies to advance impact towards indicator data. Team, I think what I want to do here is I'm going to pause the slides for just a second. I was thinking about this because, we've done this a couple of times now. And one thing that I think could be useful for you is to see what it looks like when this is kind of laid out. And so I'm going to share another screen here. So let me get this organized for us so we're looking at the right thing. Let's see. Okay, all right. So we're going to look at one example. This is a tool that the company I work for that we provide to different clients, clients really all over the globe. But I'm going to show you an example of this tool. And the tool that we offer is wired to this RBA methodology. And so Let me just put it up on screen. There's many tools out there, so I don't want you to feel like I'm trying to push something on you. This is just to illustrate, hey, what does it actually look like when we are seeing this RBA, this population accountability work? What does it actually look like? So I'm going to make sure that I'm sharing this. And I will make that bigger for you all to read. But this is a dashboard or a scorecard. And on this scorecard, you can see the result. So in the first section here, what is the result that community partners are working to advance? Remember, population accountability, we're talking about collective impact. So it's more than one partner. And here we can see, oh, we have a result. All residents in the city have livable wage incomes. We're very clear about the result we are wanting to advance. And underneath there is an indicator. Now, you all, as RBA practitioners, know that, hey, that's actually just one. We probably need more than that. We need 3 to 5. The trainer just finished telling us that. Yes. And to illustrate, I did want to just show you what it looks like with, there's only one here, but I would want us to have multiple indicators so we have that full picture of what we mean by our result. But still, on the screen, you can see the result. We're clear about the indicator that we're using to measure progress for this. I'm going to expand it so that we would be able to look at the data. So here we can see all residents, all white residents, Black or African American, Hispanic, AAPI, Native American residents, any other groups, multiracial groups. And of course, one thing I'm seeing here as I'm showing you the data is that I would want to reorder this so that it's alphabetically listed and not by any one particular group. We certainly don't want to show favoritism towards one group or another. But the important thing here, the most important takeaway here is that we have our result, we have our indicator, and then we have the turn the curve thinking, which is, I'm not going to explain it yet, but all these narrative sections that you're seeing down here underneath the data, this is what the partners would engage in order to figure out what are the strategies that we want to work on collectively. Also on this scorecard then, which you can see is that the strategies are laid out right underneath the resultant indicators. So here's our first strategy. We want to support working parents to finish job training or higher ed by providing low-cost childcare. Okay, I get that. I get how that strategy could help to address the indicator data that we've been looking at. Now we want to have some performance measures that we can use to understand progress for that. And we'd want to see that data disaggregated by different populations so that we could understand how are we doing for different groups as it relates to the strategy we are working on. And excuse me, there's a second strategy, which is we want to ensure that high school completers enroll in post-secondary opportunities by expanding a college and career readiness model to other school districts. And so there's some other performance measures then that would be connected to this strategy or this